And we realized that with a 20-minute notice, she was getting ready to be picked up and she was going to be transferred to her next placement. And we failed her. We were unable to prepare her adequately for her next placement. We were unable to provide her the clinical therapy that she really needed to help her, to give her the best outcomes that she was entitled to. And it was really from that the idea for the center came to light. So from that, we started to wrap around some comprehensive collaborative planning to really try to bring something that is currently not in place in the state that we think is going to have tremendous benefit to the children that we serve.
And Paul and you and your team, I'm just so grateful to you. Secretary Glisson, Adria Johnson, those in the cabinet, those in government, those in the private sector, those that are in these organizations that are somewhat of a blend between the two. I'm so grateful for the fact that people are seizing this opportunity.
Think about how traumatic that is for a child. 25 or 30 different placements. You might be in a hospital, you might be in a foster home, you may be in a residential treatment center. This is what the difference is going to be. Now when a child comes into state's care, they're going to be assessed. Once that child is assessed, then they're going to come up with a treatment plan with that child. What do they need behavioral health? Do they have behavioral health issues? Are there physical, medical health issues? Are there other issues that need to be addressed for this child? And what is the least restrictive placement that this child could be placed in? So now you're putting together what is truly now a continuum of care.
The Children's Assessment and Transitional Services, or CAT Center, is designed to accommodate up to 10 children in a 6-week program. That means that this initiative's reach and impact increases greatly every 6 weeks.
To see what's taking place with this program now really provides a ray of hope that maybe the kids' transition can be a little bit smoother and can be a little bit more hopeful, where they will find something that will guide them through life and give them strength. Governor Bevan, I want to say, you've been a great governor with your focus on foster care and really saying this has been a priority of yours and your wife's, and it's something that's really paying fruit for our Commonwealth. I want to thank you for your emphasis on these kids that really need our help. Thank you.
As a state that has 4.5 million people and that has 6,500 different houses of worship and any number of hundreds of other compassionately non-faith-based organizations, compassionately founded organizations, if among all those assets and all those organizations, if we can't find among 4.5 million of us homes for 2,400 young people who just need a mom and dad, shame on us. I know we can, and we're going to do it. And we're going to do it with the facilitation of organizations like this and centers like this. And we're going to make Kentucky the best place to be a foster kid in the United States of America.